Hey everyone, Paul from Health House here. Just an update to one of our most popular webinars we've ever done on CBD rescheduling back in May 27. If you've got time, there is a YouTube video of it, and we discussed the downscheduling of CBD. I think this is going to have huge impact for the industry, and this is the time frame it was first introduced, lodged in March. It was actually lodged by the TGA. And the public submissions finished in May. We ran our webinar at the end of May, and they met in June. And today, hot off the press, we've got the interim decision. By no means final, but it looks promising as far as CBD downscheduling. So this was the original application, and this is what was released today. Now, it made a number of recommendations. Firstly, it did support the downscheduling of CBD. There was a couple of submissions. I know the AMA submitted a proposal not for not to go ahead. They were concerned about patients bypassing doctors, and I believe they're looking after their own interests. But I believe the sensible decision is to downschedule it. There was a few conditions to that, and none of them which really surprised me. First and foremost, and this was an initial submission, the maximum recommended dose was 60 milligrams or less of cannabidiol and not more than 30 days supply. The CBD needs to be 98% pure. That is, the other cannabinoids don't compromise more than 2% of the total cannabinoid content of the preparation. And it's for adults only, not for children. Also in adult-proof packaging, and that's pretty standard with any sort of pharmaceuticals sold over-the-counter in pharmacies now. One thing that Rhys Cohen pointed out earlier on, I was quite surprised by this, that the TGA made a spelling mistake. They call it in one instance cannabidiol. I thought at first they invented a new cannabinoid, but maybe they made a slip of the tongue error, but yeah, we'll talk about that later. And another thing too, at the same submission, it was proposed that Viagra or sildenafil be downscheduled. That proposal was actually rejected. And I think women across Australia are breathing a sigh of relief. And I did think it would be a very hard proposal for that to get across the line. Sorry about that bad dad joke there. I had to do it. So right now, I'm going to introduce our other panelists. Rhys Cohen, who is a cannabis consultant. Hi, Rhys. He joined us on the last one. And Elisabetta Faenza from Leafcann.
Hi, Paul.
Hi. Are you surprised with the outcome? I'll start with you, Rhys.
Not overly. I think it was more likely than not that the ACMS was gonna basically, take the advice of the delegate, and that's the result that we've seen today. I think there are a couple of extra details that I wasn't necessarily expecting, and including things like restricting the kinds of products that could be made available to only oral ingestible products. So no topicals, no inhalants or vape pens. I thought that was an interesting detail that I wasn't expecting. And the other one was the explicit recommendation that pharmacists should be restricted from being able to compound Schedule 3 CBD for patients. I think that's really important, and will have a meaningful impact on what this means for people actually being able to access CBD without a prescription.
Absolutely, yeah. And Elisabetta, what's your take on?
Yeah, so this was in line with the delegate submission that we'd all been able to see previously. What is disappointing is that the research that was at the basis of that delegate-initiated submission is not up to date, and to make a decision on such a low dosage seems quite flawed, because there is ample evidence at the standard required by the TGA for both efficacy and safety at higher doses. But what we don't see at that 60 milligram dose is efficacy. We definitely see safety. And so the concern is that while it's a great thing that it's been downscheduled, it could turn out to be a bit of a lame duck.
Yeah. And Elisabetta, what do Australian companies need to do to bring a product to market and get it sold over the counter in Australian pharmacies?
Yeah, so a lot of patients, I think, would be very surprised to know that this doesn't mean that the products that are out there at the moment under the special access schemes and authorised prescriber schemes can suddenly become Schedule 3. There's a long process of registration of products, so the product needs, a dossier needs to be submitted that provides evidence of both the safety and the efficacy. We're not 100% sure whether some of the efficacy claims are going to be waived, as this is a new listing, but either way, I don't think that's good. What we want patients to receive is efficacious, safe medicines that will give them at the recommended dose a therapeutic benefit. While we're not looking for doses that would be required, say, for complex conditions where you definitely need the participation and oversight of a doctor, what we should see is for those sort of less severe clinical presentations to be allowed to access this product under the care of a pharmacist. So we don't believe that that benchmark is going to be reached by that dose. So we are struggling to see how efficacious products will actually be registered and therefore reach the public and make a difference to public health. What we think is there'll be if products manage to get through and jump all of the hoops for registration and spend a fortune doing so, that the products that come out the other end are likely to be quite a disappointment.
Yeah, absolutely. I do concur. I think pharmacists are well placed to counsel, particularly pain patients, and also given the fact that codeine was upscheduled to prescription only a couple of years ago, so there's a big gap in the market for patients needlessly suffering. Rhys, do you have anything to add about product registration?
Yeah, I mean, those are excellent points, Elisabetta. I think I don't want to look a gift horse in the mouth, because you know, any steps that we take towards more reasonable access to cannabis medicines, you know, is a good thing in and of itself. I am concerned that if we go ahead with the interim decision, we'll end up with the worst of both worlds, because as you were saying, Elisabetta, either companies won't be able to prove that a product is effective at 60 milligrams a day, which is a very, very low dose for this kind of product. And therefore, no one will be able to get products on the shelves, and therefore this will all be a pointless exercise. Or the regulator, you know, abbreviates or, you know, is reasonable about, you know, requiring a lower standard of evidence with regards to efficacy, specifically for low-dose CBD products, which also doesn't, you know, make me feel great about, you know, medicines regulation in Australia. Like if the regulators want to approve products at a lower than usual standard of evidence, doesn't that suggest that perhaps they will be more appropriate to fall into the Schedule 2 or category, or to be unscheduled entirely? And in the meantime, while we figure all this out, the concern I have is that the active down scheduling sends a signal to the community that it is appropriate for you to access low-dose CBD products from a pharmacy. And it gives this tacit approval, you know, people see this tacit approval coming from the government, saying, oh, the regulator said this product is safe, I should be able to access it. And when they find that they aren't able to access it, what that does is it's easier for them to justify buying an unregulated product online or on the black market. And I think that's already happening. I think that, you know, the conversation that we've been having in the community about low-dose CBD has only made that worse. I think more and more people every day are using unregulated CBD products. And this does send the signal that it's safe and appropriate to do so. So hopefully we can thread the needle here and find some kind of a compromise.
Yeah, no, I agree thoroughly with what you said, but picking up on a couple of points, I think it is only an interim decision. There is still a few finer points that need looking at. And you mentioned other dosage forms. It'd be a shame if other dosage forms were excluded. It's like, if it's CBD and it's safe, then it should be accessible. So I'm sure that may be challenged by public submissions, which are still open until November, I believe.
On that, I mean, I can understand not wanting CBD vape pens or inhalants, because the effective dose is much higher for those products. And if you want to control things by having a maximum daily dose, that makes sense. What doesn't make sense is also limiting or prohibiting topical creams, which probably don't do anything at all, but are much less, even less potentially harmful than oral CBD products. That doesn't make any sense to me.
Absolutely. I do think creams, watch this space, topicals are going to have a big
I agree. I think topicals in conjunction with oral medicines are going to be an interesting pathway in the future. But to pick up on Rhys's really well-made point is that when you create a demand or awareness or a marketing program, which certainly inadvertently the TGA has done with this submission that came out of the Senate inquiry and their recommendations, what happens is you drive interest and you drive an appetite for it, and people who may have been sitting on the fence think, well, the TGA says it's okay, then it's okay, and then they go to a pharmacy, try to get it over the counter, there are no products ready. I mean, these products aren't going to get Schedule 3 registration in a month. This is a very lengthy process, and so people will go repeatedly to the pharmacy to get over-the-counter CBD, not be able to obtain it, and then, as Rhys said, look elsewhere. And we already know that over 97% of people who are using medicinal cannabis for their health, so they're using cannabis for a medicinal purpose, are obtaining that illegally. And they're obtaining it from sources where there's no testing, there are no safety standards, you don't know what else has been added into it, you don't know if the cannabinoids that are on the label are actually, if there is a label, are actually in the product or not, you don't know if you're safe to drive. There's a whole range of issues, and while I totally agree with both yourself and Rhys that it is a good signal, we have to be really careful in the delivery. And so I think there are a number of companies and industry bodies who will be putting in submissions based on more rigorous evidence that they've been undertaking or commissioning while we've been waiting for this interim report. And a number of these organisations and companies, I believe, will submit a variety of responses, but the majority of those are actually saying the bar for the dose is just far too low. If we want efficacy and safety, then we need to look at the evidence that shows us that higher doses than 60 milligrams are efficacious and still very safe. So that'll be an interesting process to whether we're listened to, because what we want at the end of the day is products that are less expensive to bring to market because they're going into a Schedule 3 registration process as opposed to a higher schedule registration process. But that work for patients, so patients have their needs met, get good value, have consistent medicines, and feel better. I mean, that's the whole goal of everything that we're doing. So I think we have to work with the health department and together as an industry to really push for an outcome that will support the needs of patients and also not be a waste of time for companies.
Sure. And lastly today, what do you both think this will have, assuming it goes through in February 2021, what impact do you think will have on prices and access to cannabis in Australia? Rhys?
It probably won't. I honestly, I would be very surprised, pleasantly surprised, but very surprised if anyone was able to legally purchase a CBD product over the counter at a pharmacy in Australia before the end of 2022. That would be really impressive. I think the time that it'll take to conduct the trials required, to get your dossiers together, it's not a trivial exercise. So at least for the next year or two, this won't increase the ability for anyone to purchase a CBD product legally. I think what it will do is massively increase the rate at which people continue to buy unregulated, often imported CBD products. We're already seeing that space is basically impossible to police properly. And hopefully that doesn't cause any unwanted side effects or harm anyone. But the longer this goes on, and the longer thousands and thousands of Australians use unregulated CBD products, the more likely it is that someone's going to have a bad reaction. There's going to be a contaminated batch. There's going to be a health scare of some kind, and that's going to be bad for everybody. So in the meantime, though, I mean, on the prescription side of things, product prices continue to come down quite significantly, largely thanks to the huge influx of international exported CBD products arriving on Australian shores. So I think, in terms of long-term effects on pricing, this won't affect it much, but we can expect prescription CBD prices to continue to fall.
I agree. I think one of the things that's really important for anyone who's watching this who isn't a medical practitioner to understand is this isn't going to meet the needs of parents with epileptic children who are refractive to other treatments. Those doses are much higher, and they are complex medical conditions where, regular blood tests need to be taken to ensure that there aren't any contraindications occurring or any negative effects from intermingling of preparations with other medicines. And so I think the general public thinks, when they hear it, they think, oh, that's great, all those families that need to get more affordable medicinal cannabis for their children with rare conditions. This actually isn't going to help any of them at all. So where this sits is really, we were hoping that it would help people who have chronic pain, who have low-grade to moderate anxiety, but are functioning, people that might have, other inflammatory issues, but are not at that acute clinical level where they have a myriad of medicines and treatments that their physician is tracking. We were really hoping for those people that this would offer a way to receive product legally, so keep them within the legal framework with no risk of, being roadside tested and failing a drug test, with no risk of being drug tested at work and failing a drug test, and with a clear conscience that, what they're getting is what they've paid for, and there's no shame or blame involved in it. So, I hope that the submissions that are going to come in response to this interim announcement are going to help to shift that bar, especially with regard to the doses allowed. But I think what's really important and what we as an industry need to do is really help to set people's expectations, because we know that there is a bit of a Wild West aspect to some parts of our sector. Australia tends to be a lot more responsible than other nations I can point a finger at, but there are still cowboys around who will use this to kind of inflate the value of what it is they're doing when it may not apply to them at all. And I also really caution people, there are lots of Facebook groups where they're secretly selling cannabidiol via Messenger. There's all of these really suspect and weird behaviours going on where the patient has no idea actually what's in the product. I hear all the time from people that will say, oh, they started using a regulated product, they were getting good results, they couldn't afford it, they switched to an illicit product, now they're not getting any results. So 2 things we need to do is we need to improve access and we need to improve pricing. And that is happening in Australia. So we're seeing prices coming down. I think that in 2021, we're going to see prices come down even more. And as we see more Australian production coming online, we should also see more price pressure. And that can only be good for patients.
Definitely. No, this is a big, in my opinion, a big step in the right direction, a game changer. And it is a gradual process. But thank you so much for joining the discussion today, both to Rhys and Elisabetta. And I look forward to seeing some of the submissions, and it is slated for approval in February 2021, so there won't be anything happening before then, but watch this space.
Thanks so much, Paul.
Thanks, Paul.
See you.